Resuming debate, the Honourable Member for Nanaimo Ladysmith.
Thank you, Mr. Speaker. Nanaimo Alzheimer's Walk raised $18,000 last year to promote the critical research to reduce the effects of Alzheimer's and to provide services for those living with or assisting those with Alzheimer's, and to ease the personal consequences that exist for people and their families every day. So I hope people in my region will come to the fundraising walk in Nanaimo May 7th. It's in that spirit that I speak today to Canada's response to improve care for the hundreds and thousands of Canadians suffering from dementia and to better support their families and caregivers. I support Bill C-233, which calls for the development and implementation of a national and comprehensive strategy to improve health care delivered to persons suffering from Alzheimer's disease and other forms of dementia. Here's a call from Susan Barr, who wrote to me from the riding of Nanaimo Ladysmith. She writes, "I'm a seniors with Alzheimer's on my father's and mother's line, and I'm now starting down that dark path of dementia myself. Unless a dementia patient has sufficient means, they have to share rooms with others who are often difficult to live with and/or are violent. I urge you to go and spend 2 or 3 hours in a government-funded seniors' cares home with a closed dementia ward and ask yourself, do you want to be treated like this?" End quote. She also describes her brother-in-law, who used to be the gentlest, kindest soul. He's now been held in hospital with Alzheimer's for long periods of time because there's no space for him in a care unit elsewhere on Vancouver Island. He's been tied onto stretchers. He's been denied showers because of fears about his aggressive behavior. This is bad for caregivers, for families, and of course for the patient. So the need is great. 750,000 Canadians lived with dementia in 2011. That's 15% of seniors. And this costs our economy $30 billion each year in medical bills and lost productivity. And left unchecked, that number could skyrocket to $300 billion within 25 years. Canada's fallen behind countries such as the US, UK, Norway, France, Netherlands, and Australia, all of which have coordinated national dementia plans in place. Canada is one of the few G8 countries without one. And as our population ages, we must prepare our healthcare system and our communities for the increasing number of Canadians suffering from dementia. It's expected to double by 2031. To paraphrase Tommy Douglas, the father of Medicare and a New Democrat, quote, "Only through the practice of preventative medicine will we keep health care costs from becoming excessive." Talking last night with the Canadian Association for Long-Term Care, I was reminded that Canada's had 40 years to get ready for this wave of aging baby boomers, yet our country had no strategy and failed to plan. The Canadian Association for Long-Term Care notes that the proportion of long-term care residents with Alzheimer's disease or other forms of dementias has grown steadily, with 87% of residents affected by the disease since 2010. They also note that modern home designs and increased privacy are increasingly important for residents with dementia, who can become upset and aggressive when they're unable to get the personal space they need. So Canadians have lost precious time on this, something that is especially important to those suffering from a degenerative and progressive illness. This has had real human impact, and I've heard countless heartbreaking stories about the impacts of Alzheimer's disease and dementia on my constituents. Lynn Mayette gave me permission to read this note. She says, "Our grandfather suffered from Alzheimer's, and now our mum is in a secure unit with Alzheimer's too. We know what it is like to watch a former loved one decline. To watch a loved one decline and lose all of their dignity to the point that they are no longer their former being. To be tied into a wheelchair and left to fall asleep, sitting there to lose all their appetite and not to eat, to wear diapers, to lose control of their bodily functions, to no longer recognize close family members, to develop anger. These things, along with drugs to numb their beings to the point of comatose, these all happen. And many cannot afford quality care home home care for their parents. I talk to so many people in my riding who are trying their very best to look after their aging parents at home. They're not getting the support they need. The smallest amount of support would make a big difference to them. They know they're saving the healthcare system money, and yet it's shameful that the Liberal government abandoned its election promise to invest $3 billion in home care. They promised $3 billion over the next 4 years during the 2015 campaign. They separated this from the Health Accord, and that means that the money should have flowed in 2016, but it hasn't been delivered almost 2 years into their mandate. Instead, they're using home care dollars to try to lever agreement around the Health Accord, but provinces representing 90% of Canadians still have not received a nickel of this promised home care support. And the need is pressing. The burden of caring for patients with dementia and Alzheimer's falls heavily on family members. In Canada, family caregivers gave millions of unpaid hours each year caring for dementia patients. That represents $11 billion in lost income and 250,000 lost full-time equivalent employees in the workplace. If nothing changes by 2040, it's estimated that family caregivers in Canada will spend 1.2 billion unpaid hours per year caring for their loved ones. And a quarter of family caregivers are seniors themselves. And yet, long-standing underinvestment in care homes means that the alternatives can be dire. Laurie Amdam writes to me from my riding, why does Canada need a national dementia strategy? We need one because the baby boomers I know are scared to death of developing dementia. They believe that life in a Canadian nursing home would be a fate far worse than death. She writes, when I teach dementia care to students, I often ask them to bring to mind the worst care facility they have seen. They describe an old hospital-like unit with narrow corridors, paint chipping off the walls, and no access to the outside. Then I ask, what if we exchange the 20 people with dementia who live on this unit with 20 children dying of cancer? Would this place be an acceptable environment for them to live out their last months? Of course, the answer is no. Why then is it an acceptable place for persons with dementia who have no voice and no power to live their last years? She writes, I see more and more incidents of unsafe and unethical practices in acute care. Recently, I had to intervene on behalf of a 90-year-old woman with dementia when a hospital tried to admit a young man into the other bed in her double room. She was terrified, yelling, "Get that man out of my house, get him out." Creating the framework, she writes, which would mandate provisions of dignified and respectful care for this population of vulnerable people is certainly the right thing to do. It is no less than they deserve. They deserve to live in comfort and safety. They built this country. End quote. I can think of no better testimonial for the need for Canada to have a national strategy on Alzheimer's care. Canadians deserve no less. Now, New Democrats have a long and proud history of advocating for federal leadership on healthcare issues, and we stood unanimously in this House supporting an NDP bill on a national dementia strategy in 2015. We will stand in this House in 2016 and in 2017, despite the fact that it was voted down by the previous Conservative government. We very much are encouraged that the member is bringing this bill forward today, even though he voted against our version of it. We will stand in this House. This year we will vote in favour, and we will work so that every Canadian and every Canadian family and every caregiver can have a world-class dementia strategy, and all parliamentarians should continue to fight for this good cause.